able to do their work, they are able to do business, because digital economy is the way to go. And we are here with the director Konza, who can explain further later about the digital economy and the many computers, laptops that they have distributed into schools to ensure that we align with the global space and equally ensure that we are up to date as a country. Our young people, today if you send me to read a speech, rarely do I carry my paper. I go with my phone, the same phone that I call with. My phone is a moving office. So that is where we are going today. We are not going to the, yesteryears, where when you go to a facility or when you go to a hospital, you would go with a quarter exercise book. We are past that. The healthcare system is totally digitized. We have the healthcare digital superhighway. So really, the digital economy again is a space that we need to help and tell the young people that they can make money out of the phones that they have. The smartphone that you have can earn you money, even in social media. Ladies and gentlemen, I am here in Kisii together with directors, CEOs, chairs of parastatals. And I'm accompanied with the same chairs, CEOs, and directors of boards from parastatals from Mount Kenya region, and we are joining hands to ensure that we are speaking the same voice. That is the most important. And we are telling the mwananchi the truth. This government does not require siasa sahihi. Sisi tunataka kufanyia wananchi kazi. Sisi tunataka wananchi wapate. Give Caesar what belongs to Caesar. And the only way we can do this is ensuring that we are delivering services. And services must get to the right people at the right time. I want to speak into the generalities of this month. I want to remind the women of this country, and of course the women of the Kisii region, please remember, this is Cervical Cancer Awareness Month. If you're seated at home, make sure you present yourself to a health facility and get checked. We are gearing towards getting to the global standards, ensuring that 90% of our girls of ages between 14 and below get HPV vaccination. We also need our women to get screened. At least 70% of our women must be screened at any given time. And of course 90% quality treatment. That is why we have come up with cancer centers, regional cancer centers, to ensure that people do not travel so far to get treatment. So I want to request our women and equally our men, you can go and get screened for any other cancer. It doesn't have to be cervical cancer. Cancer has ravaged very many people in this country, starting with our families. Anybody standing here, you can attest that in your family or your neighbor or somebody, a friend, you know someone, either they are suffering or they have suffered, emotionally or physically. Therefore, I want to appeal to Kenyans that screening is the way to go, not just for cancer, but very many other illnesses. Over 70% of the diseases that we have are preventable. So why don't we practice prevention is better than cure? The other thing I would really wish to speak into is drugs and substance use. In this country, we are still at 8.5% prevalence. And what is coming out is that the women are actually getting into drugs more than men because of the new products that are in the market. Already we are preparing to go and ban some of the products that are getting into the country, and we do not need them here. And some of them, you can see products written only to be sold in Kenya. And we have told them, if it can only be sold in Kenya, then first practice where you have manufactured the product. Why do you have to come and do some survey with Kenyans? Why don't you practice where you manufactured the product, and then you can bring it to us when you know that a lot of people are also taking it. So I want to plead with Kenyans, and especially the young people, and my gender, the women. You're taking a lot of electric cigars, you're doing a lot of porches, you're doing a lot of vaping. Yesterday I had a big meeting of university students, and they told me that in some campuses, over 70% of the students have come across or we have tested drugs. Whether it is hard drugs or it is just liquor, they have tested. Maybe because of peer pressure and all that. So let us all be very, very vigilant. If you see anything that is funny, that looks